Human and cultural impact of 2015-2016 Ebola outbreak. Some background information is Ebola is the viral hemorrhagic fever that has been found in various parts of the African continent. It first appeared in the 1970s, and there's been various outbreaks throughout history since then. It's believed to come from monkeys to humans. It usually has between a 60 to 90% mortality rate. The virus has always been limited to small villages, which is usually pretty easy to contain. But during the 2015-2016 outbreak, it spread to some of the largest cities in Monrovia and Liberia, and that was when it became out of control. On May 8, 2016, the World Health Organization reported a total of 28,616 suspected cases of Ebola, resulting in 11,310 deaths. That is just the reported cases. They believe it's over double that, the cases that were not reported. While I agree that stopping Ebola should be a top priority, I also believe that it should be done in a certain way that is least damaging to the people and the cultural aspect of that community. Many rural villages in Africa have strong traditions and beliefs. Many people in rural villages also have never seen a doctor or medical teams, especially ones in the big suits that they wear during infectious disease outbreaks. When a doctor goes into a home in a certain village and takes the sick out and doesn't really explain what they're doing, put them in a treatment center, the person sometimes can die and they get cremated automatically, and the family doesn't really know what's going on. That creates fear and stigma, and that is very damaging in outbreak control. When fear gets into a community, the community usually does not react like they normally would. They become frightened, and they do not cooperate with medical personnel like they normally would. They also do not treat each other like they normally would. One of the debated things that the government did during this outbreak was the forced quarantine on the community of West Point. It's a slum in Monrovia. It has a high population that live in pretty poor conditions, and the government quarantined the whole slum off. Now, the whole country had outbreaks, but they decided to quarantine just this particular slum off, and this had some negative effects. It created a mass stigma with the people with West Point. People were scared of people from West Point, whether they were sick or not. It also created a lot of fear in the West Point community and a lot of rumors. Some of the quotes from people that were actually in the West Point quarantine was, "We didn't understand the logic. Instead of keeping or helping us with clinics and ambulances, they pushed us in. What were we supposed to do? Keep the dead inside? No one came to educate us. What is Ebola? They talked about a virus, but then they came in all of a sudden, and the day after, we witnessed the police with guns." This shows that not many people even knew what Ebola was. They knew people were getting sick, but they didn't know what from, how to not get it, or how to take care of someone when they became sick. Another quote was, "That's too bad. And even we know that they were bringing in dead bodies from other parts of the community. And why? Why is that? I think they want to exterminate us." That was a 21-year-old man from West Point. That is an example of rumors. One of the big rumors were that they were bringing the dead from other areas and dumping them in West Point to try to wipe out the slum. When people become scared, they create rumors to try to explain what they're scared of and what they don't understand. And that particular rumor hurt a lot of trust between the government and the medical personnel. There was planned aid to come into West Point, but a lot of it never came. The quarantine was eventually lifted a few days later. Studies show that forced quarantine has a negative effect on the community and social aspects of the community. It creates stigma. So one of the nicknames people called people from certain communities that were quarantined was Ebola people. They were scared of them, whether they were sick or not. They were not allowed in their villages. They were not allowed to shop. They were pretty much isolated. When distrust enters a community, they're less likely to work with the medical personnel. When someone becomes sick, they're more likely to hide that person in their home rather than reporting it, and in turn, the caregiver usually also contracts the virus, and it creates a chain of infection, rather than just bringing them to the treatment center where that one person would get treatment, and the treatment or the infection line would stop. Another quote was, "Quarantine does not work here. It drowns people in fear and economic hardship. We don't ban movements. They were free to go and get food. How can they do otherwise?" That's another thing that's brought up during forced quarantine. is how will people continue their day-to-day lives. It affects people that own businesses. They don't get their normal customers. It affects people that are trying to shop and get food. They're trying to get things, their basic supplies. If they're cut off from the store in their quarantine zone, they can't leave to get what they need. Many mistakes was made during the largest Ebola outbreak ever in history. But also some things were done right. The epidemic was declared over earlier this year. I think that surveillance should be done in a way that is less damaging to the people in the community that it's affecting. The virus itself is already damaging the community, and people coming in and creating fear and havoc and rumors is not helping the situation. I believe if they came in a different way and explained the virus, explained what they were trying to do, and explained that they were trying to help, more people would be willing to help them in return, and therefore the virus would not spread as much as it did. Like they said, they believe that the true infection rate was almost double of what was reported. That's how many people hid in their homes and never came in. I feel like locals should be more informed. It should be a top priority to inform the community that they are coming in, why they're wearing such funny suits, things to calm the people so they're not so frightened of what's happening. If local people trust the doctors and medical staff, they're more likely to come in when they are sick and not hide and return of infecting more people in the community. Community cooperation is key when it comes to infection control. Many times, outbreaks have been stopped by the community leaders declaring new guidelines for the dead instead of people coming in by force. But community cooperation is a key. I believe that they should provide more information to the locals. That should be a top priority. They should also educate themselves on the customs of the local people to try to maybe help them out a little bit instead of being such a stark difference to what they're used to. And that establishing trust with the community leaders and the community should be key.